330. The 330, of course, is 1.6 millimeters in length. You could just consider it to be the ideal depth cutting burr that we would have in operative dentistry. And we like to start a punch cut here in the mesial box area. In the event that we might go a little bit deeper than ideal, we know that our box will be in this location and we're not going to inadvertently cause a problem with the pulpal wall being too deep in one area, for example, if you started in the middle of the preparation. We're then going to take the burr from this punch cut, holding it perpendicular to the occlusal table. And the occlusal table, of course, is going to be the cus tips, and not tip the burr buccally or lingually. And that oftentimes happens with this tooth because we forget the fact that it is leaning in lingually following the curve of Wilson, and it will require us to tip our handpiece a little bit towards the lingual in order to be perpendicular to the occlusal table at all times. I like to start with just a little slit that goes down the middle of the tooth following the primary groove, maybe make an assessment how we're doing, and then just make small brush strokes, keeping the burr at full depth the whole time and extending down the primary groove. And I'm not trying to make anything particularly smooth at this point. I'm just trying to get this initial depth and configuration and the shape established. At this point, you can now make sure that you're doing okay with respect to following the primary grooves and make any alterations you may need to make, and then extend the burr approximately a millimeter into these secondary grooves that you see going off towards the distal buccal right here. I'd go the full width of the burr into that area, and then the full width of the burr into the buccal groove, and then we're going to come back and do the same thing into the lingual groove, thereby establishing the basic primary groove outline form of the preparation. And I'm not taking any extra care at this point to make the transitions smooth as I'm going to these areas. It's a rather mechanical and sort of a sharp transition from the isthmus area to these little extensions. We're going to smooth those later when we do the S-curve. But now I think it's time to move on to the box. So let's go ahead and pick up the 245 burr and drop the box. 245 burr has got a round end on it. It's relatively straight. It's supposed to be slightly pear-shaped, but it really is barely pear-shaped. And we're going to use this and probably move the entire burr to the depth of the flutes into the box area. You're almost always safe doing that. You can get an idea of what the typodont requires and make these alterations as necessary. We're going to converge the facial wall of the box, and we're going to make the lingual wall of the box perpendicular to the gingival so that the opening of the box is convergent, but it's convergent because of the convergency of the buccal and not because of the convergency of the lingual, because the lingual is in fact going to be perpendicular. And that's going to follow the morphology of the tooth interproximally. See how we're straight here and then we're tipping in over here. When you do the box, it's good to move the burr straight as you can so you can make a nice flat gingival, but also go a little bit deeper axially. And the reason for going a little bit deeper axially, like we're doing here, is to give yourself access to using hand instruments later on in the procedure. You don't want to have the box so narrow that you can't get a hatchet in there easily, or you try to cram a hatchet down into the box and you end up scratching the adjacent tooth, which I'm sure we've all done if we're too conservative with the box. So we'll continue now with the hatchet, and this is the 10-7-14, because the hatchet can fit. There's a little bit of a problem with the axial wall, but you can see that the hatchet essentially will fit at this point, and then we can just chip out this little piece. I like to call this the Sturdivant chip, although I'm sure that Dr. Sturdivant would be probably embarrassed that I called it that, but it was done so nicely in his textbook and demonstrated there. So for many years I've always thought this is something that Dr. Sturdivant had thought of, but I'm quite certain that it was invented many years before that. But we'll use that little chip technique to knock out this lingual portion and buccal portion and gingival portion of the box area to try to get some clearance with the adjacent tooth and do it in such a way that we don't scratch the adjacent tooth. Even though we're nowhere near being fully extended proximally, I always like to have the discipline of keeping the hand instrument 90 degrees to the cable surface at all times. That way I know that no matter when I stop, I'm always going to have the right exit angle. Yes, I might be a little bit overextended or underextended, but at least my exit angle will be correct. And I think that that's an important habit to get into. So we're going to use the burr again to further extend. And this is really kind of an undermining and chipping technique. We're purposely creating a little C shape or a little bird beak there on the lingual that we can then go back in with the hatchet and chip that area away. This makes it easy to extend your box without hitting the adjacent tooth, which is a challenge for every dentist in doing conservative class 2 preparations. How do we break contact and yet not hit the adjacent tooth? I think that on typing teeth it's actually harder than it is in the mouth because the enamel tends to chip away a little bit more naturally, but with these homogeneous teeth we need to make these big chips. Now watch how we use the hand instrument with the long end of the instrument up against the wall at all times, keeping the bevel away from the wall, chipping downward to break clear of tooth number 20. And it takes a little bit of patience, as this is probably the most tedious part of the procedure, but the one that will pay us dividends if we take our time and do it in this particular manner. So you see we're getting much closer to getting the appropriate extension. At this point, when you have the box pretty much roughed out, you think you've got it where you want it, let's go ahead and maybe use the hand instrument to do some refining and smooth off some of the walls, but also try to get the axial wall in a more convex shape. And that can be done by pushing the secondary cutting edge of the 10714 distally so that you're able to scrape away the axial wall in those areas near the buccal and the lingual. See, this is a distal push of the instrument. We're not really pushing down so much as we're pushing distally. I think that this is a very important trick to learn because it can give you that nice even gingival width as you go from buccal to lingual. So that's what we're showing you here, and we can take the end of the chisel also to remove any little bumps or irregularities that we might see. So we've spent a little bit of time making the box a little nicer, but really it's not done because if you look at the lingual clearance, it's not nearly enough. So we're going to assess this with an RGS-1, which is a 0.4 millimeter wide instrument, and it's not even close to clearing. So what do you think we have to do here? Well, of course, we're going to undermine and chip again. So we're going to use the 245 burr, and we're just going to feather it down this lingual wall, keeping it away from tooth number 20. You know, notice how we're really not getting the burr very close at the initial part, and then we'll just slowly move the burr over towards number 20, getting very close to it to make that little C shape so small that we can easily chip it away. So once again, we pick up a very sharp 10714 enamel hatchet and we push down on that little thing. Rather than twisting the instrument this way, we want to have the instrument angled always at 90 degrees, and we practice that discipline of achieving extension while maintaining the proper exit angle at all times. You can see how we're pushing it down with the proper angulation of the hand instrument. Now, having done this, you can see that you created some irregularities. There's irregularities along the gingival, and the axial wall is now looking worse than it was a few minutes ago. So that's okay. We're mainly concerned about getting the proper extensions. So we knew we could do it before, we can do it again. So why don't we use the handpiece as much as possible and be efficient. I like to quote my mentor, Dr. Warren Johnson, who always said, use the handpiece to define the preparation and use your hand instruments to refine the preparation. So we don't want to spend an inordinate amount of time with hand instrumentation when the burr can do it so much more efficiently and better for that matter. It makes for a smoother wall. So once you've got this box to the point where it's the proper dimensions, you may spend a little bit of time refining the gingival, refining the exit angles if you have any small areas that might have undermined enamel. And then we can assess this again with the RGS instrument, once again, 0.4 millimeters just fits. And then look down at the gingival, you can see that it's approximately 0.5 millimeters. Of all the extensions, the gingival could be the one that's more than 0.5 and you wouldn't have any trouble. This is an RGS-3, and we can look at the axial depth or gingival width, mesial distally, and see that it's more than 1 millimeter, which is great. And this is the RGS-4, which is 1.5 millimeters. And you can see that the depth is less than the RGS. So we're right in that 1.2 to 1.4 millimeter range, so we're in pretty good shape. Now the preparation really only needs one more step, and that is refinement in fabricating the S-curves. This is the 330 RGS. And the burr is not intended to start your preparation. Some students that have been using this are trying to use it to cut the entire prep, but it just doesn't work. It's mainly for refining. And you can see that this is the 245, and the 330 RGS is 2 millimeters in length versus 3 millimeters, and it has a much flatter bottom to it. And here's the 330 regular versus the 330 RGS. You can see that the 330 RGS has a flat bottom to it, it's convergent, it has that little blue stripe on it so you can really remember which burr it is. I'm going to bring up my iPad here and I'm going to do a little sketching. So I've taken a photograph of the prep at this stage and I'm going to show you how I would handle the S-curve. So in green here I'm outlining the exit angle on the facial and then the exit angle on the lingual. And then I'm going to draw in the 90 degrees you can see here on the facial side, and then we have 90 degrees here on the lingual side. Now I'm going to go ahead and sketch in the axial curvature, and interestingly the preparation should also have 90 degrees internally on both sides as well. And this is possible because of the curvature of the axial wall, which is yet to be refined. You can see this is the triangular ridge on the mesial facial and the triangular ridge on the mesial lingual. And right down the middle of the triangular ridge on both of these, on the mesial facial and mesial lingual side, we can mark a little red dot, and that will be the end point of the S-curve. The S-curve continues into the cusp approximately 1/10 of a millimeter and then makes a nice sweep into that little red area. 1/10 of a millimeter straight in, and then it follows that sweep around that direction towards the middle of the triangular ridge. So that's the S-curve, or the reverse S, that we've all learned to love. And then we're going to take the burr also and we're going to look at these sharp edges that we've established by doing this somewhat mechanical preparation that we did on the rest of the prep, and we're going to smooth those off as well. So anything you see that's a sharp edge around the rest of the preparation, the 330 RGS will very nicely round off these little sharp areas. So we'll just take these little areas here on the distal part of the prep. Any transition will then be smoothed. And we do this at this stage because the burr is ideally formulated for this particular purpose, while giving you a very nice flat pulpal wall rather than a pulpal wall that has a dip down the middle like you would have with the 330 standard burr. And then of course when the S-curve is done, the surface area of the pulpal part of the preparation increases. The box stays the same. So here we are with the 330 RGS, and we're just going to start by just slightly rounding it off. Don't try to get the whole S-curve at once, but just sort of slowly work your way into it and stop and assess your progress as much as you need to. And you can get a feel for this burr. It doesn't cut aggressively like the 330 burr does. It's a very minimally cutting burr. It does it in a very controlled manner, maintains your convergency so nicely. You can never do this with a 55 burr. 55 burr is going to destroy your convergency, and a 55 burr, if held convergent, is going to destroy your pulpal. This burr allows you to get both the pulpal wall flat and the remaining walls remaining in a convergent shape as you're finishing the preparation. So it's pretty sweet for that particular purpose. The burr was made longer than the 330 on purpose so that it could smooth the entire wall, not just the minimal 1.5 millimeter areas, but all areas of the preparation.